Right now, let's get the latest from that conference. We now cross to our reporter, Jayed Paulse. Jayed, a very good afternoon to you. Alarming, statistics there from that conference, particularly listening to some of the delegates saying, that South Africa has alarmingly high TB infection rates, coupled with the largest HIV/AIDS prevalence. This is globally. What did they have to say today?
I think that message right there from Prof. Kogie Naidoo just drew, took us back home and brought everything back into perspective for us. But I think a lot of talks have been around the COVID-19 pandemic, how far we have done in the TB treatment, HIV and AIDS, coupled with that. But right now, Unati, I am coming from the floor, the exhibitors where we're seeing diagnostic testing. We've spoken to some exhibitors who've showed us what they're using to test for TB, especially in the rural communities, in the areas, far-flung areas. You would know that KwaZulu-Natal and many other provinces, especially the Eastern Cape, are very rural. So we were looking at those diagnostic tools and they were showing us how they can take those mobile clinics to the people and to the communities. Now, I want to bring it back home and bring it back to the floor. We've heard the panelists, we've heard the global experts, but I want to speak to TB survivors and hear their stories and hear what more needs to be done. I am joined by Siyabonga and David. Let's start with Babzungu here. Babzungu, tell us your story. Obviously, we're trying to break the stigma, break the barriers, but also ensure that more people are tested for TB.
Good afternoon to the viewers at home. My name is Siyabonga Uzungu. I'm a TB ambassador and a TB survivor. In 2012, I was diagnosed with TB, and I was entered into 6-month treatment, later on in 9 months treatment. And I'm just encouraging people to visit the local clinics to do the checkups, because at that time mobile clinics were not there. But today our government made it easier for us, because each and every sector in South Africa has mobile clinics where they just go to the people. We're taking healthcare services to the people. People must use those resources in order for them to make sure to do checkups. And we call upon the focal person within our local clinics to make sure that they have TB survivors caucus and teams, and making sure that people, they are just well known about TB.
Babzungu, obviously you contracted TB and your family found out there's still a huge stigma around tuberculosis. Just take us back to your story. When you found out that you had TB, did at any point in time, did you think that you would one day contract it? Tell us more.
I didn't know at the time that one would contract TB at that time. And I don't want any person to go through what I went through at that time with my family, because the stigma started at that time. And when you had TB at that time, they were just thinking that you have HIV, yet they are married, the two are married. But in the long run, people are well educated. I knew that TB is a standalone item. That is why I'm fighting for every people in South Africa, or every citizen in South Africa, to make sure that they get access to do the checkup. And TB must be #1 priority in South Africa in our healthcare services.
And it's so true what you say. There are so many more newer advancements and developments now compared to back then. Thank you so much, Siyabonga Zungu, for talking to us. I'm just going to move over to David. David, your story was very fascinating. You worked underground. You were a miner, contracted TB. Tell us your story.
Basically, 2001, I started working in the mines. I was working underground. I started contracted at pulmonary TB, 2007. And I think around 2013, I also contracted a TB, which was TB meningitis. 2017, that was the last TB that I had. So through all this path, I had to see that an opportunity to go back to the communities and try to teach them about TB. TB is curable. Here am I, live and kicking. So why not I go back to the communities where I live and advocate for those people that are not able to see that TB is curable. So the aim is for us as activists and TB ambassadors is to call upon every stakeholder to come and join us in the fight to end TB. So that's the message that we are sending through this conference, to say a private sector, public sector, come on board, help us as South African National AIDS Council and civil society to fight it and have a mandate to end this, because it's killing our people. We can say per day in South Africa 167 people are dying due to TB, but we are able and we have resources to end TB. Hence we say #end TB. That's what we are all about.
Do you really believe that enough is being done in order to fight the prevalence of TB, especially in rural communities?
Hence we are calling upon government, and we are calling upon political parties to join us, because you'll find that in the rural areas there is a shortage of mobile clinics. There is a shortage of medication. They don't have any that access to such things. Hence we are calling upon for all these sectors to join us, so that we are able to help those people in the rural areas, especially in KwaZulu-Natal and especially in I think Mpumalanga, and also in Northern Cape. There's that huge gap that we must fill. So we need all those stakeholders to come on board and join us.
Thank you so much, David, for speaking to us and sharing your story as well. And I do believe that the LTE organization, as well as the health department, we have spoken to them and they're saying they are going to make sure that they roll out more mobile clinics. I'm going to finish up with Phumeza here, Tisila. She's also an activist. Phumeza, you've also been at the forefront of fighting tuberculosis, but also the stigma surrounded. And you know what? We talk about COVID-19, we talk about HIV and AIDS and how far we've come with the country in terms of, drawing the spotlight on that, breaking the barriers, breaking the stigma. Tuberculosis, how far have we come?
So with TB, as you might know, TB has been labeled many things, like a poor man disease, this and that. And the fact that TB only had one TB vaccine, whereas with COVID-19, the pharma companies were fighting to make the vaccine. So that's the problem. That's why it started, because it only affects a certain population of people, but it affects everyone. Anyone can get TB. Anyone who breathes can really get TB. So with stigma, it's a long way. There's still stigmatizing languages. Even in these conferences, TB patients are being TB patients are being objectified as if they are objects. They are called cases. Instead of calling someone, you can't call someone a case, a TB case. You don't hear that in HIV. You hear people living with HIV, but TB is a different thing. I'm not sure why. People living with TB should be called people living with TB. You cannot call someone who's to be evaluated for TB as a TB suspect. Suspects are to be known as criminals. You cannot do that with TB. The stigmatizing language, and also there's a project called Use My Voice to End TB that is funded by Stop TB Partnership. So what we are trying to find in the communities is a community-based research. We're trying to find where the stigma is occurring and what is the problem. So we went there and then we found out that people actually experiencing stigma in hospitals and also in their own homes, whereby we found out that some people even get disowned just because they got TB. So that's the problem. So we tried so much to try to destigmatize TB, but only we can do so much. For instance, with COVID-19, it showed us the wearing of masks, normalized the wearing of masks, whereas before at the clinics, only TB patients were only allowed, the only people who were allowed to wear the mask. But now we actually went back again to the community to ask their views on the mask wearing, and then the nurses and then some of the staff, they were they're uncomfortable now at the clinics, because at first it was okay, everyone was wearing a mask, but now a patient who's there to test for TB, they are only give the patient who's there to test for TB, but not the person next to them. Again, that's where the TB manifests, because the person next to them will ask, why are you being given a mask? People ask questions and it's uncomfortable again for TB patients.
And you would think that after the COVID-19 pandemic and after all of us have worn masks, that stigma would have fallen away. It's quite strange and very ironic. Thank you so much, Phumeza, for speaking to us. Well, Unati, some stories there from TB survivors talking out, who have now turned to be activists at the forefront of fighting the prevalence of tuberculosis, but predominantly in rural areas. As you heard there right now, KwaZulu-Natal leading with the highest number of infections across South Africa, and then also the Eastern Cape as well, making sure that mobile clinics reach those far-flung areas. Earlier on, we were speaking to an organization that is building mobile clinics that can actually fit into a suitcase, ensuring that they are able to go into these areas and treat patients. Well, we are at the conference, the TB conference, and we will be running up until Friday, bringing you the latest information, the latest developments on the TB front, and keeping you up to breast with all the news. It's back to you.
All right, Jayed, thank you so much for that update. Of course, she is coming to us live from Durban, where that TB conference is currently taking place. Jayed Paulse there for us.